Miss Grace?
Yes.
Hey, my name's Glenn Adams. I'm a physician assistant student and going to be taking care of you today.
Hi, nice to meet you.
You too. This is me washing my hands. How are you today?
Good. How are you doing?
Good. Is it okay if I take just a couple minutes to jot some stuff down so I can chart all everything correctly?
Mm-hmm.
Okay. This is my blank sheet of paper. Alrighty, Miss Grace. So what's bringing you in today?
I'm having some pretty severe eye pain.
Okay.
I don't usually wear contacts, but I did today, and I guess maybe they were an old pair, and that is when I noticed the burning like an hour after I had them in. So I took it out and like it just continued to get worse.
Okay.
It's like red, very watery. I can't really keep it open at
Okay.
all. And so it's just like almost unbearable.
Okay. I'm sorry you're having to deal with that. That sounds very painful.
Yeah, it is.
Okay. So, when did you say that you first noticed this pain?
It was like an hour after I had my contacts in, which was about 5 hours ago.
And you said it was an old pair of contacts?
Yeah, it's the one-a-days, and I wore them, like, I guess maybe I wore them one other time.
Okay.
I had only planned on having them in for a short period of time because my friend was meeting me and she had my other contacts, but it was a mistake.
So you were just going to put the old pair in just for a couple hours to see. You were supposed to get the new pair, but you shouldn't have even put them in.
Yeah,
okay.
It started hurting before I got the new pair.
Okay, and you said that you noticed it an hour after you put the contact in.
Yeah.
And then how long did it last?
It's still going on, so it's been like 5 or 6 hours.
Okay. And can you show me which eye burns?
This one, my right eye.
Your right eye. And is it in a specific spot in your right eye?
The whole thing's just burning.
The whole thing burns. Alright. And can you describe the pain to me again?
It feels like a burning or like a scratch maybe.
Okay.
And it's a little itchy, but I don't want to touch it. Yeah, it's mostly like a burning sensation though.
Okay. That sounds painful.
It hurts a lot.
I bet. Alrighty. Have you noticed any associated symptoms with the pain?
Mm-mm.
No.
My eye's just very watery, but that seems like normal here.
Okay. And has anything made it better?
Closing my eye.
Okay. Has anything made it worse?
Opening my eye.
Okay.
Or like air, like wind or something.
Okay.
And light.
And light makes it worse too?
Mm-hmm.
Does the burning pain sensation radiate anywhere?
No.
Okay. And I know you said it just happened like 6 hours ago. Have you noticed any patterns with the pain?
Mm-mm.
And on a scale of 0 to 10, 0 being not painful at all and 10 being the worst pain you've ever had, where would you rate this?
Probably like a 9.
A 9?
Mm-hmm.
We'll get that fixed as soon as we can. Have you had previous episodes with this?
No.
No. This is the first time you've had this? Okay. Now I'm going to ask you a lot of questions, and these are just me yes or no questions. We'll follow up on the yeses, and this is in terms of your eye pain, like so the past 6 hours. Okay. Have you noticed a fever?
No.
What about chills?
No.
Have you felt fatigued?
No.
Do you have a general feeling of unwellness?
Yes.
Yes. Can you elaborate on that for me?
I guess maybe the pain is making me like hot.
Okay.
It's not a feverish thing, but I'm like sweaty.
Okay.
From the pain is what I would think. I don't know.
Okay. Do you have a generalized sense of weakness?
No. Just in the eye, I guess.
Okay. Have you had any appetite changes?
No.
What about weight changes?
No.
Okay. And you have eye pain. You said it burns.
Mm-hmm.
Have you experienced any blurring?
Yeah, it's like, I don't know if it's the water or what, but I can't really see out of this eye.
Okay. And have you had any experiences with seeing double?
No.
What about discharge from your eye?
Mm-mm.
Is your eye dry?
No. Probably because I'm just like crying though.
Yeah. Have you noticed any floaters in your eye?
No.
Does it itch?
Yes.
Can you describe that to me?
I guess I would describe it as an itch. Like, it just hurts, so like I naturally want to rub it, and like maybe it's like a little tingly, I guess, on the like edges of my eyelid.
Okay. You said that looking at light makes it worse.
Yeah. It's just like sensitive, I guess.
And if I'm looking at it, would you describe it as red?
Yes.
Have you noticed any spot, like when you're looking at something, do you see spots?
No.
Okay. Is it swollen?
No.
Have you had any changes in the acuity of your vision? Just like how accurate it is?
No.
What about, and you said it was watering. So
Mm-hmm.
that's the main problem. Okay. Alrighty. Have you had any abnormal nosebleeds?
No.
What about any obstructions of your nasal pathway?
No.
Have you noticed any polyps in your nose?
No.
Has your nose been running excessively or abnormally?
No. I mean, probably like just a little from the crying.
Okay.
But I think it would be related to that.
Have you been sneezing?
No.
Do you have sinus pressure?
No.
And have you noticed changes in your sense of smell?
No.
Alrighty. Last group. Do you have any mouth pain?
No.
Have you noticed any bleeding in your mouth?
No.
Have you noticed an abnormal bad breath?
No.
What about hoarseness?
No.
Any masses or lesions in your throat?
Mm-mm.
And is your throat sore?
No.
Alright. Made it through. All right, now I'm going to ask you some questions about your past medical history. So to start, have you ever been hospitalized?
No.
Have you had any surgeries?
Just my tonsils.
All right, how old were you when that happened?
Like 14.
And do you remember what hospital it was at?
It was just at the dentist.
Okay.
Wait, what? No, I didn't get my tonsils taken out. I got my wisdom teeth taken out.
At 14?
Yeah.
That's fun. And do you remember what dentist office it was at?
The Louisiana Dental.
What city is that in?
Slidell, Louisiana.
Are you up to date on your immunizations?
Yes.
Did you get your flu shot last season?
Yes.
Good for you. Are you on any medications right now?
Just Adderall.
Adderall, and how much do you take?
10 milligrams.
How often?
Every day.
Do you take it? When do you take it every day?
In the morning after I eat breakfast.
All right. Any other medications like supplements, vitamins, anything herbal?
Nope.
Okay. Are you allergic to anything?
No.
No, nothing seasonal or animal?
Not that I
food
know
allergies?
of.
Nothing medical?
No.
All right. Now I'm going to ask you some stuff about your family. Are both your parents still alive?
Yes.
Can you tell me how old your parents are?
My dad is 59.
Okay.
And my mom is 56.
Do you have any kids?
No.
What about siblings?
Yeah, I have 2 sisters and a brother.
Can you tell me about their ages in chronological order?
The oldest is 30. The next is 28. And the next is 27.
And who is that in the middle? Brother or sister?
Brother.
And then sister is 27?
Yeah.
Okay. So in terms of yourself and the family that we just established, so your parents and your siblings, has anyone been diagnosed with high blood pressure?
My mother.
She does. Okay. Can you tell me about that?
I think she's been diagnosed for like 5 years or so.
Okay.
Her dad also has high blood pressure.
Okay. Does anyone have diabetes?
No.
What about high cholesterol?
No.
Heart disease?
Nope.
Has anyone had a heart attack?
Not in my immediate family.
Has anyone had a stroke?
No.
Has anyone been diagnosed with cancer?
My mom.
Can you tell me about that?
She had breast cancer. Like, how old am I? 10 years ago?
So 2010.
Mm-hmm.
Did she make a full recovery?
Yeah.
That's awesome. Okay. Now I'm going to ask you some questions about your social history. And I want to preface that with everything I'm asking you is just to take better care of you. There's no judgment here. I want you to feel comfortable answering these questions. Alrighty. Do you use any tobacco products?
No.
Do you consume alcohol?
Yes.
Can you tell me about it?
Like 3 times a week. Not anything crazy.
What are you drinking?
Like beer, pretty much.
And when you do drink, how many beers are you having?
Like 3.
Okay. Do you do any recreational drugs?
No.
Can you tell me a little bit about your diet?
It's like, I don't eat like super healthy. I eat a lot of salmon though.
A lot of salmon?
Yeah.
Do you monitor your salt intake?
No.
Alrighty. And do you exercise?
No.
Are you employed?
No.
Do you have insurance?
Yes.
And do you have a way to pay for your medications?
Yes.
When you're prescribed? What's your living situation right now?
I live with my parents.
Okay. And do you feel safe at home?
Yes.
Are you sexually active?
Yes.
Do you use protection?
Yes.
Yes. And have you been screened for sexually transmitted infections?
Yes.
Alrighty. Alright, Miss Grace, so what I'm hearing, I just want to go over this, make sure we're on the same page. Please stop me if anything is wrong or you need to add anything. So about 6 hours ago, you put in an old pair of wear once a day contacts, and about an hour in, you started feeling a burning pain in your right eye. It's made your eyes really watery, nothing really makes it worse except having your eye open and light, and it feels better when you close it. Yeah, is there anything else you want to add to that?
No, not really.
Alrighty, thank you so much for your time.
Thank you.